The development of and publication of the ACP guidelines really disturbed a number of us in the diabetes community, and that's why I think you could see that there was a pretty swift response that was coordinated across multiple organizations that rarely work so quickly together. So in a sense, it was pretty unusual. And I think there's much in the ACP guidelines that are very helpful. I think there was some confusion that was created perhaps and where we feel they missed the boat on a number of key issues. And some of those issues are, the goals for A1C really need to be individualized, and we clearly agree that for the elderly with limited lifespan and poorer quality of life, those A1C goals need to be much higher. What ACP missed was the fact that people earlier in the course of the disease without a lot of complications really should be managed to a much lower A1C goal. And there's evidence to support the benefit of that. The other big area that was not addressed in the guidelines, and we incorporated in the Joslin guidelines that are now being published, was the incredibly exciting new data around how to prevent cardiovascular disease with the right choice of treatment for glucose control, and the SGLT2 inhibitors and the GLP-1 agents. Both of those have been demonstrated to lower cardiovascular risk, and that really is a pretty dramatic change in the way we manage our patients. And the ACP sadly didn't really recognize that or include that as an important piece of the recommendations and guidance.